Thank you for that introduction. Steve and myself have teamed up together to present a 4-session and then a live session talk and discussion on solutions-focused approach. My background, I'm Owen, is worked all my life not all my life in training and coaching, but training and coaching has been a big part of my life. And I've been practicing now the solutions-focused coaching for 2 to 3 years. Steve?
My name's Steve Freeman. I'm a nurse by background and do some training and education in solution-focused, and I'm also the National Development Officer for the United Kingdom Association for Solution-Focused Practice. So I've been practicing for about 20 years now and used in a range of settings. So, Owen, you've got some questions?
Yes, I've got some questions. First of all, before we go into the approach itself, Steve has got a passage to talk about before we go into the approach.
As with a lot of things, sometimes a short example is a good way to introduce an idea. Friederike Banning, who's a coach and trainer in the Netherlands, came up with the idea of a situation. So if you could imagine that you're hungry, you go into a cafe and you simply want to order some food, but the manager says, well, how long have you been preoccupied with food, and why do you think food is such an issue for you? Was food a problem when you were a child? What were your parents' attitudes to food? And do you find that you become obsessed with food? So having answered all these questions, you're still very hungry and you eventually get to order some food. But before that, the manager says, well, that's all well and good, but first we've got to collect even more information. We need all this data about your dietary habits. So here are a set of questionnaires which have been researched and put together to find out all about your food behaviour. If you could fill in these, and then we can get you some food. So very patiently, and getting more and more hungry, what you do is fill in all the questionnaires all about food and your beliefs and so on, and then you're given food that you didn't order, and when you say this isn't what I ordered, the manager says, well, we know best. And what Friederike is suggesting is that very often when we come into contact with people in situations where we need some help, then it's the expert that drives what we get. So this could be in healthcare, it could be financial advice at the bank, it could be simply asking someone for directions. So the solution-focused approach would be much more about working with the individual rather than working with the expertise of the person who's providing the service. And I think, Owen, that kind of sums up the work that we both do.
That's absolutely right, Steve. I think the central approach to solutions focus is that the client is the expert on their life, and we're experts basically in the solutions focused approach. So therefore what we're getting basically is a dual expert role rather than the coach or facilitator being the expert on the other person's life.
I think you're absolutely right, and I've done most of my practice in a health setting. So what we're finding in mental health, physical health, health behaviour change, for example, is that if we take the only expert approach, if I as a nurse or as a colleague, as a doctor says, what you must do is this, then very often patients will say, yes, that's a good idea, leave the hospital or the surgery and really just carry on with what they were doing before, which is absolutely right, because they've spent 20, 30, 40 years developing their lifestyle and being very comfortable with it. What we find is if we ask people about the changes that they want to make, or about how they can change things that they may not want to change, but what's the most palatable way of doing it? So a good example of that would be with stop smoking. So people can be very heavy-handed about the way that they talk about stop smoking, make lots of threats. You know, if you continue to smoke, you'll get lung cancer. You know that smoking has this effect, it has that effect. And really, after a lot of interventions like that, what people really want is to go out and have a cigarette because they've been intimidated and frightened. What the better stop smoking services do now is work with the individual. And so a good example would be, when are the times that you least need a cigarette? Or when are the times that you most need a cigarette, and what could you do instead?
I actually think you're absolutely right there in what you're saying, Steve. Just to go back slightly though, when I worked possibly for 15 years as a financial advisor consultant, and the role was of an advisor. Now if we actually take, and the role of an advisor is to give advice, is to promote the solution and give the solution to the client to decide whether he wants to take it up. And what I actually found out from doing that is the fact that if the solution didn't work for the client that I'd actually recommended, then we had two losers. Whereby if we actually get the client to think through to his solution and for him to make the decisions on where to go and how to approach it, with the help of the coach, then I actually think that is a far more sustainable way of a client, or maybe particularly, as Steve has pointed out, a smoker being able to quit smoking because he's made the decision, he knows the approach that works for him best.
And I think you've hit on a really important point there. We are talking about solution-focused practice as if it was something new and wonderful. Well, it is pretty wonderful, but it's nothing new. Very often when I'm in practice, I'm just reminded of the approach that my mother would take, my grandmother would take, in terms of doing more of what works. If you're in a situation that you can't change, how can you adapt to that situation? And conversation we had recently about this idea of solution-focused practice is just uncommon sense. It's the things we think about. Either, if we're lucky, we think about them at the time, and sometimes we think about them in retrospect. So it's after an event. We think, well, what I should have done is this. And your example there of the way that you worked in a previous career was very solution focused, even though you hadn't come across the approach at that point. And I've had the same thing working in engineering. I'd never heard of solution focused practice, and yet worked in a very solution focused way, because it was, what have we got to do to get this job finished? It's no good sitting there and hoping that it's going to get better, or trying to turn the clock back. That simply isn't going to happen. So what have we got? This is where we are, and what are the next steps?
Now, I think we've actually covered that approach at the moment. What we now going to actually have a quick discussion on, and questions I'm going to ask Steve, is first of all, the history of the solutions-focused approach, the philosophy, and how it is competency-based.
Okay, so the architects, if you like, of the approach are Steve DeShazer and Insoo Kim Berg. Sadly, both died in the last few years, and they were based in Milwaukee in the States. They were working in a family therapy centre in an area which sounds fairly familiar to any of us coming from an industrial town in the UK, really. Milwaukee had had lots of heavy industry. As the industry disappeared and jobs disappeared, there were lots and lots of social problems, and so the family therapy centre was fairly busy place. Legend has it that at a team meeting, the staff noticed there were some families who did well and there were other families who didn't. And very often it was working with what the families did well that fixed the problem. So from that, the philosophies started to develop, and then there was a huge amount of research done by the team at Milwaukee, both into the theories underpinning it, but also into their outcomes. So it's very evidence-based in its origins. The principle is, as I just mentioned, do more of what works, do less of the things that don't work, and identify what you would rather be doing, so a preferred future, and then go on to decide what are the incremental steps which will lead you towards that preferred future. So some of the key questions would be, in a solution-focused conversation, would be, how would you see your future? What's your future perfect? Or what's your preferred future? And get a rich description, get as much detail as possible about that, and then ask someone to describe where they are in relation to that preferred future, and what would be the first tiny step that they could take towards moving from where they are now to where they would want to be. So scaling questions are an integral part of that, of joining up the, if you like, the theory of this is where I'd like to be, and the practice of this is how I'm going to get from where I am now to that point in the future that I want to be at.
Now, I'm going to ask you just 2 or 3 questions. When did you actually first hear about the solutions-focused approach, and how did you get involved with it? And can you share a couple of memories?
I was a late starter in nursing, so I'd already had 2 or 3 careers by the time I went into the health service. And although I enjoyed the job, I felt a sense of dissatisfaction with the way that health services were being delivered on a daily basis. Just after I'd qualified as a nurse, a course was offered, and it was 2 days, which I wouldn't be working on the ward, and I was promised a good lunch. So, knowing nothing about the subject, I agreed to go on to the training course, and it was an introductory course to solution-focused brief therapy. That was a turning point in my career, and from the day after that course, my whole practice in nursing changed. I was very, very fortunate that I had a line manager and a consultant that I was working with who also saw the benefits of solution-focused practice. So from there, I spent about the next 15 years or so developing the approach within a trust. And what we found was that brief therapy was okay in a therapeutic context, but we could also have the same conversations with people in managerial situations, supervisory situations. So pretty much anywhere that human beings were having a conversation, we could take a solution-focused approach. Standout memories for me would be some of the training courses that I did within the trust. It was generally, solution-focused practice was generally well received, but there was a colleague who was on one of the courses. She's about my age, which is the top side of 50. She'd been a nurse since she started as a nurse cadet at the age of 15. She got grown-up children. At the end of the 3 days, she came up to me and said, "Where were you 20 years ago?" Sounded like a chat-up line, but she went on to say that if she'd come across solution-focused practice 20 years previously, then her marriage would have been a success, her children would have been raised differently, and the level of satisfaction that she got from nursing would have been so much greater. So she hadn't got any great regrets, but she did realise that had she come across solution-focused practice, it would have been very, very different. And I think maybe the other standout memories are around people who had pretty much exhausted everything that the health service had got to offer. And then that's not a criticism of the health service, but there are a number of people who simply don't fit with what the service that's provided, a wee bit like the cafe we were discussing earlier. And I built up a caseload, if you like, or a practice based on people who were at the end of the line. Tried everything, nothing's working. Steve, will you see this person? And it's the fact that by and large they were turnaround cases, so people who themselves felt hopeless because they knew that the health service hadn't been able to fix whatever it was that was having a negative effect on their life, and after a few sessions they were able to fix that themselves by taking a solution-focused approach. So to summarise, solution-focused approach is about the expertise of both people in the conversation. There's the expertise of Owen and myself asking questions and recognising that people are best able to fix themselves.